So, welcome to Extraordinary Lives. Today I've got Dr. Price and his beautiful wife, Carrie Price, his biggest supporter. Will you explain to me? I think you guys use a reference PX, and I see that a lot. So, what does
Mhm.
that stand for, and what is that?
So it's the pediatric experience. So Dr. Tony Ebo is one of my mentors and a good friend.
Okay.
He himself has his own miracle story of his son that it's just amazing how
Yeah,
chiropractic
I
care
recommend you go listen to his story because it was
cured.
pretty
I mean,
amazing.
just amazing change for his son who was having had an extreme birth.
Okay.
They were life flighted to a hospital.
Oh, wow.
And he was having seizures, everything as an infant,
Okay.
and he went through all those things. And now his son is about the same age as Trayson.
Yeah,
Okay.
track athlete.
He's a track athlete,
Oh,
one of the
yeah.
best track athletes in the Midwest, where he's going to probably get scholarship to do all these things. But he
Wow.
was never, that was never a possibility. He was told, your child is going to be brain dead. Your child is going to
Oh,
be this.
gosh. Wow.
And so this is what started him, well, led him down that path
Okay.
to where he's become a master at teaching how to actually implement this. Hey, how do you do all this? What's the framework to build off of? And he's partnered with Dr. David Fletcher, who developed the Insight scanning technology.
Okay.
Partnered with, and so he's built this foundational network of providers that, hey, here's a framework to build off of. And a PX doctor has gone through the training
Okay.
Yeah.
to understand that, because his goal is making this available to everyone. It is such a dramatic need.
Yes, it
Yeah.
is.
It is so needed. And there's, I mean, it was just like we were saying, Dr. Hafer, we're in the same Treasure Valley. She said, you should go do this. She's not, that's such a
Yeah.
dramatic need. She doesn't care. She can't keep up with the volume.
Right. There's not this competition of like,
Yeah.
only I want to do it.
No,
Right.
it's
Yeah, no,
just-
we need
yeah.
more
Yeah.
chiropractors that do
That's
this
so
type
amazing.
of
Yeah.
method. And I think what's good to know is, yeah, you get the basics of the chiropractic training, but the PX actually goes really deep into the neurologically focused training of chiropractic.
Mm-hmm.
And I mean, Tony even brings hands-on patients. So guys in clinic like him can actually, and women.
It's
Can-
his seminars.
Yeah, his seminars are
are the
really
most
in-depth.
helpful, in-depth seminars I've ever been to.
Really.
And that's the thing, is it's always trying, like I said, I'm always trying to get better and better. His seminars get better and better. And this is the whole community's philosophy, is always getting better and better as a community.
Right.
And so that's the PX, is this pediatric
Okay.
experience, part of being that community.
Well, and talk about how, because I guess I don't even know, how do you get PX certified? Because you're considered
So-
P, like, and every time you go, you're more certified in the method.
Okay.
The
or something
basic
like that, right?
certification is, I think, a total of 80 hours
Oh, wow.
of training, online education, and then in person a whole weekend, solidifying that. And then he has other certifications like a prenatal, perinatal. So all these different things
Okay.
that are building on that education that you were given, hey, in your doctorate. Because the basic chiropractor in school, you don't learn near enough to be doing it, you know,
Yeah.
or understand the application. And this is just like any provider. You come out and you come to any situation, hey, I'm going to use the toolbox I have, and I'm going to do everything I can because I want to help you. But if you don't understand when not to use certain things, you're not helpful. And that was one of the biggest things out of school. I didn't understand when not to use things,
Okay.
when not to adjust, like you said, for
Right.
you, hey, where
It's
to.
too much.
Yeah. Well, and I think when someone says they work with infants or pediatrics, because we do have some of those. And I always tell moms, you really need to find a PX certified, because I promise you that they have more in-depth training on how to work with your child with disability, your baby who's not nursing, your son or daughter that has autism or sensory,
Right.
or we have a patient with dystonia right now. I promise you they have more in-depth knowledge of the neurological system and how to clinically apply chiropractic than just someone that says, I work with babies, infants, and families.
So is that specialty portion of
Yes,
that part,
exactly.
right? And
Specialty.
so
Yes.
now, talking to potential people that want to become chiropractors, what advice would you give them into figuring out what route they'd want to go, like being a chiropractor, which you have experience in, and then also being a PX chiropractor, which is what you're doing now? Because I'm sure there's a lot of people that are in school right now and trying to figure out what's
Yes, please go to school.
yeah.
Be a chiropractor
We
and
need
take
more.
the PX.
Yes, we need
Yeah.
more.
Well, PX is the really cool thing is Dr. Tony he has clubs in all of the chiropractic colleges. So you can actually get in right away and start being a part of the club and learning that while you're actually going to school. I mean, I wish we would have had that.
Yeah.
We just didn't have that while we were going to school. I actually remember Dr. Tony, do you remember he came and spoke to us because we have those seminars? Do you remember?
Mm-hmm.
Yeah.
Oh, yeah.
And he came, and I
totally.
remember him telling the story of his son. And I thought, wow, this guy is so awesome. But at the time, we were just going to school. I think he had just started his try. But then it come back full circle when I saw him again. And you know how the algorithm knows when you're typing and stuff. Oh, my son might be getting an autism diagnosis. What can I do? Or my son is like really struggling with this gluten product or this and that. I'm sure the algorithm was like, oh, this mom needs Tony in her life, and showed me that ad, and then I started binge watching all of his stuff, and I was like, this is the missing piece. My son has birth trauma. My son had this. He needs this care. I need to tell my husband about this. And that's kind of the snowball of how like it came to be, and really how Summit Life Chiropractic. I always say everyone has to thank me. No,
We do actually.
Yes.
because I
Yeah,
was
your
the
determination and
the
stubbornness.
trailblazer
Yeah.
of just getting in there and being like, okay, I know. And like, you just know. And I want moms to really know, like, listen to your intuition. I know that doctors will tell you this is this, but you know your child, and you have this intuition that nobody else has, not even the father.
Right.
And so I feel like if you can trust in that and trust what God gave you, that intuition, that is going to take you farther than listening to this diagnosis that they're trying to stamp on you.
Yeah. I agree with you on that.
I'd say one of the most helpful things I have talking to families is just literally, hey, what's mom's intuition? And I think that's one of the issues. If you have a provider that devalues your input, your intuition, they're not the right provider.
Right.
They'll just grow out of it.
And
They'll just grow out of it. They grow into more issues.
And I've told parents that too. In my experience, like I've fired doctors because I'm like, we're not on the same path here. Like we don't align. And I mean, although they're specialists and stuff, I could just tell it either they weren't listening to me or they were telling me what's going to happen or there's no hope or whatever. I'm like, okay, that's fine, but you're not mine.
One of the doctors I actually respect the most was a medical doctor who's treating Danny.
Okay.
And at the time he was having grand mal seizures. In his later stages of life, he developed multiple different things long story short, my mom met with him and she went over her goals and different things and and the doctor said, hey, I'm not the best doctor for you. This is the tools I have. He went through, these are the tools and things I'm trained on using these medications, I'm not the right doctor because I don't know how to do this. And he was humble enough to just say, I'm not the right
I love
fit.
that. Yeah. A lot of
And
respect for him,
Yeah.
to be able to say that. But yeah, I think that, talking to, like, going back to the question of what advice would you give to people that are in school now, in which route? I mean, is it more of a passion that you have for working for kids, or is it something that you want to be specialized in? So what advice would you give those people to maybe look into?
The number one thing is, yes, what are you passionate about? So I have a very good friend of mine. He's very passionate about structurally based chiropractic care, correcting curvatures, and he's amazing at it. I see him because I have old rugby injuries that he helps me with. So it's really figuring out, hey, what part under chiropractic or where are you more passionate? And go 100% into it. And sometimes that changes. So I was drawn toward, changes or comes full circle. Like I said, I was drawn to become a chiropractor because of my brother.
Right.
Then I was also in chiropractic school playing rugby. And so I did a lot of sports and athletic training and different things because I was playing rugby. I was passionate about rugby at that time. And this is a lot what started me off of my chiropractic career.
Okay.
And then it's amazing how it actually just came full circle to where, hey, what initially got me into chiropractic is what I am so passionate about now. And that's where it's being willing to, hey, follow that and make sure you're going 100% in that direction of where you're passionate about. And then be willing to also know, hey, where I'm focused at isn't the best thing for that patient. Like I told you, my friend that is very structurally based, I had a young lady who came to me. Her medical doctor wants to fuse 12 levels of her spine because of a scoliosis. And we could go into a lot of things with that. And she was like, "Can you help me?" I'm like, "I can help you feel better, but I can't help that."
Mm.
So I said, "We're not going to treat you here. I'm sending you here to
Okay.
Yeah.
because that's his specialty. He's amazing at it,
Right.
Yeah.
but it's not where I'm passionate and it's not where I can do be the most benefit for her."
So you
Yeah.
can separate the ego of wanting to help everybody to the point of
Exactly.
like, I'm not
Absolutely.
there.
And
And
even for that's what we want to see more in the medical community and more even with functional medicine. Cause I think sometimes too, we even get families that it's like with functional, man, they're pushing every supplement, every detox. You
mhm,
know what I'm saying? But then it's like, why can't you just put your ego down for just a minute and refer
right.
instead of saying, oh, I have all of the answers.
Answers.
I have this.
Right.
Because for us, we can say, hey, well, let's do this chiropractic care, but we've also referred, hey, you need to go see this functional medicine doctor now because your child does need a heavy metal detox. Or,
Mm-hmm.
hey, you need to go and see a hormone specialist now
Mm-hmm.
because, that's what you need. We don't specialize in that.
Yeah.
And so we want to be able to, go to providers and say, hey, this is where you need to go now that your nervous system is in homeostasis. Now you can go and see these other providers. And we're hoping that we see that more in the medical community where they're saying, oh, hey, your baby's had lots of birth trauma, you probably should go see a chiropractor,
Yeah.
Yeah.
but instead it's not that
Right.
way right now. They're like,
Yeah.
oh, the chiropractor is going to break the baby's neck. Oh, the chiropractor. No,
Yeah.
that's not how this works.
And
So
so my dream for we're having an expo this year and this fall. It's going to be the Intellectual and Developmental Disability Expo. Not sure that would be the name, but that's what it's about, right?
Yeah.
And so bringing in specialists like you, bringing in special like functional doctors and stuff to
Yeah.
meet together and to be on a panel to work together, and like how they can work with each other
Yeah.
instead of against each other, because we need those options, right? As
Yes.
100%.
parents and
And
um,
sometimes still medication too.
mhm,
So we should be able to talk to the doctor and say, oh, for instance, Riley's on this medication, but he's also getting this care. Let's see how this is coinciding and actually talk to each other.
exactly. Dr. Condi is Riley's neurologist, and I absolutely love him because he's somebody that believes in quality of life over medicating. And so he goes, and when I first met him, after, so what happened with Riley is he had all those seizures, and I took him off all of his medication at like 3.5. And then he seemed like he was seizure free for about 4 years after that, still doing really well and progressing. And then I think it was about another 5 years, so it was 12 years. He had breakthrough seizures. And I'm thinking maybe it was because he was going through puberty at that time. His body's changing again, chemistry's
Mhm.
changing. And so when I brought him in, we were then referred, because we had moved from Seattle to Boise, we referred to Dr. Condi. And my first thought and my anxiety rose immediately because I'm like, they're going to start putting him on all this medication. I can't go through that again.
Yeah.
And so when I
Mhm.
talked to him and said, listen, I know he's having these seizures. I know we have to stop them, but I cannot have him live the way he was before, because he was literally like a rag doll. There was nothing there. He was
Yeah.
just existing. He goes, I'm going to be the kind of doctor that prescribes the least amount of medication that I can. And I'm like, okay. So
I
he
love
heard
that.
me, right?
Yeah.
And then he knows I can bring Riley to you. And he loves that. I mean, he's very much a person that's like a doctor who is he's a neurologist. So he's very smart, very passionate
Oh
about
yeah.
his
Yeah.
job. But he also knows that there's people like you that can also help him in his job, because his goal is for Riley to get better. How if we work together, then let's get that. Like, let's get him to
Exactly.
progress and not just exist. And that's a big part of his philosophy as well. Is like, we want these kids to thrive. Like, let's get them to the next level. So
Yeah.
at this expo, we will have like Dr. Condi. We'll have you. We'll have other functional medication doctors. There are stuff too, functional medicine doctors that can work together and show people like me and other moms and parents stuff like, hey, this is something that we can all work as a community to
Yes.
get our kids to the next level of getting better.
Absolutely.
So,
Yes.
I do want to talk about autoimmune disease, because it seems like that's on a rise. Like, I have so many friends that call me and say like, "Oh, I just got diagnosed with this, and I got diagnosed with this, and I'm not doing well." I'm like, and it seems like in the last 2 years, I've had a number of friends that have now said that they have this autoimmune disease. And I'm like, what? And it's like to the point where they have, and I can't even name all of them, but some of them are really debilitating to where they can't move. Sometimes they're so
Mhm.
inflamed or they have a flare up and stuff. So how could chiropractic help them?
So yeah, like you said, autoimmune is this whole rabbit hole, and well, rabbit hole is not the best, but there's so many things going on.
Mm-hmm.
It can
Storm.
become so complex. But a lot of it is back to our original comments talking about the autonomic nervous system. So the autonomic nervous system, you have your sympathetic, parasympathetic. Okay. So when you're going into a sympathetic or fight or flight mode, your immune system is being controlled based on how you're adapting to the world. So when you're in extreme fight or flight, think of it really simple as my nervous system saying, hey, I can't get sick right now. Okay. So it creates what's called this H1 immune response. Shuts off your immune system, says, I can't do it right now. There's viruses, there's stuff going on, ignore it. We can't do it.
Okay.
Okay. You can't do that very long, of course.
Right.
Okay. Because that's all still there. And then all those viruses, bacteria, whatever, are also getting more of a foot in the door, in essence. Okay. And so then your nervous system's also like going to have this huge swing to what's this H2 immune response to get well. This is where I have a lot of kids, they're chronically always sick because they have this huge pendulum swinging back and forth with their nervous system, never creating this normal balance where it's adapting.
Got it.
Now, you take all that and then you add layers onto it with it, often usually involving the digestive system is one of the biggest keys, inflammatory issues in the gut, where you're getting all kinds of exposure to extra things in your immune system is getting this huge swings, never getting a balanced approach, and it's getting exposed to so many different things because you're so inflamed as a part of this process.
Right.
The immune system literally starts attacking itself. There's this understanding what they thought for years, say an antigen, which the nice thing because of COVID, everybody understands more of our immune function in these terms, where it's only supposed to, hey, I've recognized this one thing, I'm only going to attack this one thing. What they've understood now is if you get this elevated levels of your immune function just always high because you're in this mode, everything inflamed, they start adapting and they can start confusing things. So when they see something as foreign,
right?
they're always supposed to attack this new foreign thing. But now there's so much going on, they start confusing, hey, your thyroid against what's foreign. So then they start creating autoimmune issues with your thyroid, autoimmune with this, and it's this
Or like
chronic
our patient
level.
that had Crohn's.
Yes.
You know?
And you said celiac. You had a patient that had celiac as well that
Yeah.
came in, right?
Yeah.
So I feel like that's on a rise too. Like
Yeah.
I feel like a lot of people that I just know personally just got diagnosed with it or have been fighting with it or have an
Yeah.
issue with it. And I'm like, I've never even heard of that, really 20 years ago.
That's all.
Wasn't
Well,
a big, I mean,
we could.
Yeah.
Celiac's its own huge fun layer of that, but an underlying issue is the nervous system's overwhelmed.
Right.
So celiac, the underlying issue, you have this gluten, and gluten is this protein in most of our grains, okay, that they've found several studies, everyone gets inflamed to it. Doesn't matter if you're celiac or
That's why
this
we get
person
tired
who
after
doesn't.
we eat lots of carbohydrates.
Some of
right?
it, but everyone creates this inflammatory response that they've been able to measure.
okay.
So a celiac person has extreme inflammatory responses to this gluten protein. But what's changed in our society that's made the gluten so much more of a problem to our gut, to our nervous system, all these things, is first off, you think of how long did it take your grandma to make a loaf of bread? Okay.
Right.
Soaking it, all these things. And a seed,
Nice.
Yeah.
the seed is a grain seed is meant to evolve to get through us and into the ground so it can grow.
Right.
So if we don't soak it and get rid of these outside layers where it's meant to get through us and get to the ground, it's meant to inflame you enough so it can get through you and grow in the ground. That's how
Okay.
basic it's been
That makes
millions of years,
Yeah.
right? Then, so we're not preparing bread the same. So those layers that are there meant to irritate our gut are still there.
Got
Okay. Then number two, gluten has this really binds onto the glycophosphates, and glycophosphate it's be used with all herbicides, all these different things, and it's binding to it, and it's creates more of an inflammatory response.
So does
So-
the inflammation that you have now bind to the stuff that's not supposed to be in your body, so it helps hold on to it? Is that what?
So now what you're doing is you have the gut inflamed. So we think of two things that often happen when you're stressed out, these immune issues, your gut's not doing what it's supposed to. Maybe you're getting constipated. One of the biggest issues with constipation, you're not getting rid of waste.
Right.
So, and if your gut's inflamed, so celiac underlying issue, we're seeing gut inflammatory issues. You take your intestinal system, you have miles and miles of literally, think of it simple like finger projections that come out, and then they're supposed to create these tiny little doors that after it gets through down to absorb the nutrients when they're broken down enough. But if you have an inflamed gut, now those are huge.
Right.
So now you have things that are literally getting into our bloodstream
So they call it like
that are
leaky
big,
gut. Like,
leaky gut,
Right.
Okay.
because the inflammatory issues.
And then causing the
so
autoimmune,
then,
right?
well, the autoimmune becomes you
Yeah.
have all these things in your blood, and so your immune system's like, what the heck do I do with all this?
Right.
Yeah.
So you have the elevated antigen levels, elevated everything. You're in this fight or flight mode, trying to figure out how to adapt to it, and then there's more of a confusion that gets created. So that's where it's not one simple, hey, this led to this. It's this whole combination. And this is where also like functional therapy, so many things are amazing, and there's detox and things to help with all this. But if you're stuck stressed out, nervous system stressed out, your vagus nerve, one of your cranial nerves, controls your inflammatory response. The people are so focused, gut brain, thinking, hey, I'm going to do these probiotics, all these things. I'm going to heal my gut to my brain. Well, it's also brain gut. The inflammatory response of your gut is controlled by your vagus nerve.
Yeah.
So an unhealthy vagus nerve, or a vagus nerve who's not communicating as well, not getting this information, you're seeing this inflammatory response not established well, because the vagus nerve is the biggest part of your parasympathetic resting, healing, digestion part of your nervous system.
Yeah.
So if you're not
Right.
creating this balance and helping it function well, you're always in this inflammatory problem. And then you build on top of all those other things I talked about, the leaky gut and all those things.
Yeah. So chiropractic care can help that because, again, and working with functional medication when it's ready
Yes.
and
Yeah.
time like that. So I think that's what people, again, giving them hope and say, hey, and the thing is that I love about chiropractic, it's not going to hurt you. So it's not like you're going to take a medication that could potentially have all these
can't
different side
overdose
effects.
on it.
Right. So
Right, you
there's
know?
these things like there's no downside to
Yeah.
having chiropractic care.
Yeah.
And
Yeah.
I'm like, if that's the chance I had with all medications, and you know what I mean, that would be a different
Exactly.
story. But there's not. So like, why wouldn't you try it? Like, why wouldn't you try and do it, and not just once or twice? Because you might not see something once or twice. You know, there's going to be a time frame that it will take.
Well,
but,
our patient that had the really bad autoimmune Crohn's in the wheelchair, I mean, her care was so intense. And I mean, we
And then
started to see small changes after a little bit, but I mean, she was seeing us for a good 8 months, you know, and it was consistent. But again, we were her last resort.
yeah,
We
So
were her
she was
last
like,
resort.
I will do anything because I cannot function like this as a mom. I can't do this.
but that
know?
8 months versus how many years now that she has ahead of her,
Exactly.
not living in that misery,
Yeah.
you know, and getting that diagnosis like this is just going to be your life now. It's like this is your new normal. You know, it's like no.
Well, and she's
I
a
don't wanna be-
megaphone for us.
Yeah.
I mean, she's
I love it.
educating all the patients when she comes in. We're like, give this girl a microphone,
Yeah.
you know. But she had such extraordinary results, and that's what we always say in our clinic is we're a clinic of results and we're a clinic of miracles.
Yeah.
And we promise that if you stick with care, obviously we don't promise, you know, like diagnosis and
Right.
you know.
Well,
we
back to
don't-
what you said
yeah.
before. I mean, what's the biggest side effect you're going to get of chiropractic done appropriately? Nervous system functioning better.
Yeah.
Exactly.
There's no downside. There's no negative part,
Exactly.
right? There's only up. Like, so even if you get that or you don't have the pain that you have, I mean, that's all progress and it's all for
And
the better.
sometimes that progress is also understanding the framework of it. I have a 13-year-old patient we're working with now. She's very autistic. And I sat down with her father the other day and I'm like, hey, you see these fun changes with her. She's becoming kind of obstinate, very outspoken and all these things. But she's a 13-year-old that was never a terrible 2 or terrible 3s.
Right.
So
No,
there's
she's
stages
going
of
through-
neurological
Yeah.
development. She's now
So
going
let
through
her
that
do it.
aren't
This
Right.
is
fun.
neurological
Yeah.
But it's
development and
amazing.
healing.
That there's actually progress. It's actually good
Exactly.
progress because
Yes.
it's like,
So-
okay, these are things that are.
So it's understanding and framework of, hey, what's happening with the nervous system? There's phases of healing that sometimes aren't fun, but they're healing.
Right.
Exactly.
Well, and I
She's
think
cute.
it's so amazing to talk about these patients like Riley and your patient that you talk about. But I mean, going back to being a caregiver, because that's been a lot of my life, and I talk to a lot of parents that go through that, is that to be able to get their central nervous system back to baseline to where they can get a good night's sleep for once, or these things are so important that I really encourage them to get in there too. And even though it's hard for us to make time for that because we always put ourselves on the back burner, but being able to, it's like they say, you can't serve from an empty cup, right? So I ran into that where I was just like so overstimulated. I had a very stressful job being a loan officer for 32 years, you know, being the breadwinner, taking care of Riley solely by myself, making all these decisions and everything. I was healthy though. I worked out, I ate right, I didn't drink, I didn't smoke, I didn't do any of the things that I shouldn't do. But I did everything that I should do. You know, I ate
Right.
clean and all these things. And then I still had a grand mal seizure that ended up with the brain tumor. And so I just feel like it's that stress that I wasn't, even though I thought mentally I was dealing with, my body's like, no, we're not dealing with this. It's not. I really think that's where it came from, is the stress that even though I felt like I was a high functioning, stressful person, right? Like people say, how do you do it? But I wasn't doing my body any good because I was even working out. I was lifting heavy, doing all these things that was putting more stress on my body that I didn't understand. So had I understood back then what I understand now,
So even all those amazing habits, and I have so many things that people are doing now, from cold plunging and all these things that are amazing habits that are supportive for your nervous system, they're not resyncing and healing the nervous system.
they're good
And
for
that's,
a very
Yeah,
high
they're
functioning, very
regulating it. They're
good.
not actually
they're
healing it.
supportive.
Yeah.
Yeah, they're supportive.
They're supportive when it's the nervous system's functioning correctly
Exactly.
and not in fight or flight mode. So
And they helped you get through that season.
Right.
Just imagine, hey, where would you have been handling all that stress if you didn't have the habit of adapting and releasing some of that stress in the weight room?
oh yeah,
Yeah.
there's no way.
Or
So-
if you would
Yeah.
have been, 100 pounds overweight,
Right.
or,
Yeah.
and that's where we always tell, especially moms, you have to take care of your health too, because your health is going to help you take care of your children
Right.
too, you know?
Now, talking about all the things that we talked about, and what's the biggest thing now is people weight loss and getting on Ozempic or GLP-1 and peptides and stuff like that. But talking about cortisol levels, and when you're stressed, you have high cortisol levels. Like, how does chiropractic help with all these things and weight loss, and where does that come into play?
So cortisol levels is directly related to how your nervous system's adapting.
Okay.
Adrenal, cortisol, stress, it's a stress response, and it's an adaptive stress response you've created to deal with life. And so I wish it would be amazing. Hey, I'm going to adjust you. You're going to lose weight.
Right.
No. But if we can get where your nervous system's adapting and not in this fight or flight state, then those weight loss therapies and different things have so much more. And I see it all the time. I have patients, they're like, I haven't changed anything other than coming in, but now the weight's starting to come off. Well, if you're stuck in fight or flight, cortisol's through the roof,
Right.
weight's never going to come off.
And even
So-
if you add a peptide, yeah, maybe it can help. But I've met people where they get on the peptide and it's not helping. But it's like, have you had your nervous system checked?
Yeah.
Do you know how well your nervous system is functioning to even handle those peptides, or handle, let's just say it's a medication or the detox, or, something to help your gut?
Yeah.
We don't know. And that's what the main question I always ask all my friends is, have you ever had your nervous system scanned? Have you ever had your nervous system checked to see how healthy it is?
Yeah.
What? You can do that? So I think, even like you said, getting that scan and at least just getting it checked. That's what I always tell people.
Yeah.
You're never committed to treatment,
Right.
but come and get scanned
Yeah.
and see how healthy your nervous system is.
Right. What I think is so important, and it's an eye opener to actually see it, because it's something that you can physically see.
Yeah.
It's not something that only a doctor can see and only a technician can see, but you as a patient can actually see your scans and see where you're light up red, and it's like, oh,
Yeah.
okay, this is
Well,
where
that's why I
stuck.
tell people, I'm like, this is not woo woo.
Yeah.
I mean, we can actually physically test, and we can measure, and we can see it, and we can actually prove it and show you.
Yeah.
And then this is where in our office too, which sets us apart, we do these scans a lot. And Dr. Christian's always like, okay, rescan, let's see where you're at. Because he wants to see that pattern change.
Right.
And it's
You
really
know,
fun
And then we're
reviewing
constantly
that.
measuring. We're able to show you that measurement of like, here's where you were and here's where you're at now. Here's where we're going. And to see those neurological changes happen in the body is amazing.
This father, we're seeing his family, and he was like, I used to think that was woo-woo, and we're going through the re-exam, and just like she was saying, and I was like, no, watch, and we could literally track along with how she's doing, how everything's changing through her re-exams. I was showing, here's how it's trended, how it's improving, and he could see it all, and it was just really amazing to him, and now he's become one of the biggest advocates. He's like, I used to think this was, my wife made us do this because we were going to do this, and I was just like,
Yeah.
he was against it all the time.
Yeah.
Yeah.
Well, my favorite saying, I say this, is I'd rather be woo woo than cuckoo.
Yeah.
Cuckoo is thinking that your body cannot heal
Right.
when it truly can. And we can actually show and measure and show you the results. And that's what we pride ourselves in. I mean, we have a girl who does our scans, and, we keep her busy. Okay, rescan.
Yeah.
We got to rescan here, rescan, rescan. We got to see how this pattern is changing. I mean, what other doctors are constantly rescanning?
Right.
Or even when you get your blood panel,
Yeah.
are you retesting to see where that's at?
Yeah. And how often, like
Yeah.
like you said, I think that's so important. But I think that when you're talking to patients and stuff, we all we're very impatient patients. We all want miracle right now. We want to see this drug taking effect right now and seeing it working. And so we're so used to conventional medication or to taking like Tylenol over the counter stuff. And like, oh my, I had a headache. And an hour later, you don't have a headache anymore. So we become so impatient that we're willing to risk what good therapy could be or should be in lieu of that. So I think that, and when you say, okay, let's just have the patience to be a good patient and listen to the chiropractor and do these things, you'll see the results, right? And it's not just going to be a Band-Aid on something to where it's just going to cover up, but not fixing the underlying issue. And I really see that's where it's helped me and it's helped Riley. And when you talk about your patients, I can see, because I obviously follow you guys and stuff, and I love that. But really understanding that it's not going to be an overnight thing. It's not going to be something that's going to happen, in the next 2 or 3 visits. It might take 8 months. It might take 4 months. It might take longer. But if you see even just a little bit of a movement, like you said, like that father's saying, right? Like, okay, this isn't maybe the behavior that you want from your child, but it's good behavior because it's something that now she's like, her body's finally catching up to where she should have been at the age of 2.
Well, maybe you should talk about the hierarchy of healing, because I feel like that would be something maybe a little bit more to understand why, some people take longer than, do you know what I'm
Well,
saying?
that a lot just comes into the base discussion is, hey, the foundational, if you look at a pyramid for healing, is your autonomic nervous system, getting that in balance. Then you layer on the gut movement therapies and all these things. But the thing you said is the patience to understand neurological healings takes time, but it's actually healing.
Right.
It's not a Band-Aid. It's not getting a quick result that's going to fade and create other issues. It's actually creating healing, and it takes time. And sometimes that time is literally, hey, first off, we got to get the nervous system to a place where it's healthy and maintain that. So the nervous system's almost trusting. I'm like, hey, I'm in a healthiest spot and I'm staying there long enough to where I can take on the challenge of doing this next step.
Right.
Well, and we had a little girl like Down syndrome, and it's like we always say eat, sleep, poop. We want to see these basic things happening, because if you think about even us, we should be able to eat, sleep, and poop very naturally. But if some of those things aren't happening, so we're not sleeping and we're definitely not having a bowel movement, and you probably noticed that in Riley as well.
Oh, yeah.
There's so much neurological issues that are happening if we don't have those 3 basic things.
Right.
And so even with babies, even with kids with disabilities or autism, we always want to see those 3 basic things. And that's kind of where I feel like kind of ties into the hierarchy of healing.
And it comes into also looking, like you say, everybody wants these quick, it's also looking, how is the nervous system healing? There are soft signs of neurologic change. Some of them are as big as, hey, a big bowel movement.
Blowout.
Okay, blowout.
He's called the poop doctor.
Yeah.
That's
So
what moms
that
call
is a
it.
sign of neurological healing. And sometimes it's literally, hey, look, we had this little girl, she was just in today, but we started her exam and dad wasn't sure he was on board with it until I started like, let's watch her run it. So I just let's watch her run around. And you could see her running around the office. She wouldn't sit still at all, but her whole body's twisted and contorted. So yeah, she met her milestone, but she is terrible at them.
Right.
Super inefficient, falling and everything.
Oh, gosh.
Can't sit still because there's no neuroorganization. We adjusted her, and that visit, all of a sudden, her organization, her movement was 100 times better.
Wow.
So that was a soft sign of, hey, she's taken that information and it's cleared up the confusion where she's so much more efficient.
Right.
But it's understanding those soft signs of neurologic change. Because, you have your big goal miracle. We want to see all these things, and we all do. But it's, hey, how is that change happening over time? And those are the big things to pay attention to.
Yeah. And they're important. Those are all very important things, like Riley not having that bowel movement and having that anxiety and all that stuff. And then he came back and he was able to do that. And then sleep for those 10 hours was just so amazing for him because he was so
Yeah,
anxious,
well, and
right?
even having a mom in our office being like, my, you know, they ate a banana. They've never been able to do that because of the texture,
Okay.
you know. But again,
Yeah.
eating, we want to see them eating, and but again, it's things that I take for granted. I would never think twice. Oh, I just give my kid a banana and he eats it. But to children who have sensory or autism or
For
children with
sure.
disabilities, that's a huge deal for this mom. So it's like she's crying over a banana, but
Yeah.
it's such a big deal to her.
Right.
But it's a big deal to us,
Right.
because that is a sign of healing.
Yeah, which is so cool.
Yeah.
I know when Riley was on those medications, he was a baby and he would scream when he'd have bowel movements. I mean, it would be like he was like it would be excruciating. We'd had to do the what do you call the insert things and stuff just to get him to go. And I mean,
Suppository, yeah.
I wish I had known you then, to bring
know.
him in, because honestly, and it's a lot of problems because that medication does cause constipation. And when you're so sedated, well, it's not just your brain that's sedated; it's all your body's sedated, right? So your muscles to get things moving and stuff aren't working; they're slowed down, and so yeah, you're going to have babies that or kids that are on these that need to be on some of these medications for sure, but they can slow everything down. And I know how I feel when I get backed up and I just feel sick and sluggish and all these things. But I
Yeah.
can verbalize that and go get help. But for these babies or these people that are nonverbal, they can't. So I think that's another thing that parents really need to look at. Like, if nothing else, and your kids aren't having regular bowel movements, go to Dr. Price. Go get
Yeah.
them fixed. Go get that help. Because that
Yes.
alone can make a huge difference in
Yeah.
just their well-being.
Well, just in general, if mom, it's like something's not right,
Yeah.
follow your gut.
Yeah.
Something isn't right. Don't just accept, hey, they'll grow out of this
Right.
rough period, because we were told that with our oldest. Hey, he'll grow out of it. He'll grow out of it.
And instead, he
Instead,
grew
it just
into
became a
harder
deeper problem.
challenges.
Because what's a colicky infant in grade
It's-
school?
Yeah.
It's the kid that can't sit still. Oh, he's ADD. Well, colicky is just an infant that can't soothe themselves.
Right. Self-regulate.
ADD,
Yeah.
I can't soothe myself, can't
Yeah.
sit still, can't pay attention.
Well, and that's where they start throwing, like I said, going back to Bellman's, oh, we'll just give him, Metamucil, give him this, give him that. It's like, I don't want to give him, like, that's
Yeah.
the short-term effects. Like, that's not
Exactly.
something that's sustainable, right? And
Yeah.
so medication aid, and again, some medications are needed, and I get that,
yeah.
and I'm not against any of, parents make their own decisions and stuff.
Yeah.
But if there's other alternatives that can help that, then, like, why wouldn't we want
Yeah.
to do that more in a holistic manner?
And how much can we back away from having to use those as much?
Right.
Like, we have a patient that was, he's 6, and the first time in his life, she didn't have to use a suppository to help him have a bowel movement
Such
with
an amazing
chiropractic
day.
care.
Yeah.
But guess what? He still has to use them sometimes.
Yeah.
One of the biggest things you learn and develop as an infant is eat, sleep, poop. And eating is working the motor pathways to swallow, organize movement through your gut, and push everything through. So he's never learned how to develop it. So it's going to take time. And so, hey,
Yeah, 'cause his body's
yes,
just
there's
now
at
learning
times he's
it.
going to have to use it, because
Yeah.
you can't let him just be in pain and be miserable. But
Yeah.
now the frequency of needing that's getting less and less.
Which is amazing.
And what
Yeah.
should be looking at these medications is, hey, we need it, but how can we use it as a bridge to get past this?
Yes. Or how can we use what you offer as, as an aid to help that
Exactly.
movement,
Yeah.
so we don't have to be on that forever? Or,
Mm-hmm.
like the naturopath that we went to, it's like she just said, I understand that you have him on this medication, but let's give him back everything that these medications are robbing his body of, minerals and vitamins and all these other things. And so she was very good about that. And I do appreciate you the way you guys think and your philosophy there, because it's important.
Yeah.
So I think parents just need to, like you said, listen to themselves. But your testimonies that you have from, like, I'm your biggest advocate too. I mean, not just for myself, but for Riley, is
Well,
just
and
know
just an
that,
invitation, like who's ever listening, it's an invitation just to come in and see,
and
you
these
know?
Yeah.
these doctors are around the country, right? So
Oh,
you
yeah.
just look
Yeah.
for a PX doctor,
There's,
and how would they look for that?
Yeah.
pxdocs.com.
Okay.
And there's right there, find a doc. You can put your zip code in and find
And we
one
can give it
close
to you for
to
the
you.
show notes.
Okay, yeah,
Yeah.
I'll put that on there. So is it docs like DOCS or
DOCS,
Okay,
yeah.
so
Yeah.
okay.
And then they have a platform where you can put in your zip code
Yes.
Okay.
and find a chiropractor.
And even if
in
you
your
want
area.
to dive into understanding more, Tony has done an amazing job creating education. He has a podcast we can give you a link to. It's
Okay.
Experience Miracles Podcast.
That's a great.
And it's all directed, hey, to communicating to parents.
Yeah, and he'll take a topic. So he'll take like autism or sensory or kids with disabilities, and he'll really dive into it.
That's
And
phenomenal.
then we even listen to it. Our care advocates do. So we can just constantly be learning.
Yeah.
I know Christian does. And then again, to be able to articulate it, because I think sometimes, like you even said, to learn this and then be a full advocate of what we teach, sometimes, it's hard because even when I was talking to mom the other day, she's like, what? Like, so it's not hereditary. It's not, it's
Right.
what? Like,
Yeah.
I'm so confused. So you're saying because of how they were born and then they get chiropractic care, but then being able to explain it. I think Christian does a great job, but Dr. Tony, he really has a lot of analogies that helps us be able to
Understand.
learn and understand, especially mom
That's
language.
the benefit as
Yeah.
well as it's a communication that's based on talking to parents.
Mm-hmm.
And that's why I listen to it, because I want to get better at talking to parents.
Right.
I often get stuck, throwing out these terms because they're always studying, trying to do this. And this is often, sometimes people are like, this
know, I'm
doctor
like,
So
didn't
we need layman
communicate
terms.
well.
Yeah,
Like, what does
I'm
this
like,
mean?
don't say dysautonomous, or I don't even know how to say it. Don't say that. Nobody knows what that is. Like, say what that is,
Yeah.
because
Yeah.
that's like the circus happening inside the nervous system,
Yeah.
so it's easier for parents to really understand. And then when you see it click and the light bulb go off, they're like, wow, I get this. I'm like, yes, and I was there too, trying to put all these puzzle pieces together. But again, I don't want parents listening to think it's complicated. Honestly, it is not complicated.
Right.
It is actually really simple. And chiropractic adjustments, the one that Christian does, they're very simple and they're effective, and we can actually measure and we can show and we can prove it to you.
Which is amazing.
Yeah.
So tell us, how do people get a hold of you? Where do they find you? How do they make appointments? What's the process? So say they call your office, they make an appointment. What does that look like?
So in my office, typically the first appointment, I'm sitting down with you for 45 minutes to an hour.
Okay.
We're talking through all the history, understanding, hey, where you're at, what's going on, getting as much information as I can to understand it. And then we have a part of that appointment is also getting scans.
Okay.
So those scans start with a heart rate variability. And then there's a thermal scan that rolls up your spine and measures temperature difference in a surface EMG. Now, the scans themselves give us so much amazing information, but it's also very easy to customize those to anyone. Meaning, I have some patients where we struggle and we work and we'll get those scans, or we might get one or two to start with
Okay.
because they're very sensory kids coming in. And that's one of the things too, is understanding there's so many times that parents are like, I can't do any of that because my kid won't even sit still. I'm like, that's why we have a toy room
Yeah.
and
Distractions.
distraction
Great
and
stuff.
play. And so
Yeah.
it's fun and it's this process. It's
Well,
like,
you
hey,
see Dr.
we're
Price
going
running
through this.
around,
Yeah.
like, our
Yeah.
care advocates,
Well,
like,
in
with
my
these
experience
kids.
with Riley, he's always bouncing. He's always moving. Like, he doesn't sit still. He's always
Yeah.
bouncing. But you were able to
Yes.
get those scans and stuff. And so I think that's why I want to talk about this process, is that it's not, even though the initial is long, it's a lot of it's just getting to know the child. But the scans and stuff themselves don't take very long.
No.
And so
They don't take very long, depending on the person. Sometimes they take longer.
right.
Yeah.
Or the child. But the biggest thing, it gives us so much information. And I take all this information, I go home and study it.
Okay.
Okay. Evaluate, hey, based on what we're seeing here, what are the areas we want to focus on? Hey, how fatigued is the nervous system? And hey, what are we seeing? What type of chiropractic care is better? Because that's also understanding there's not one specific adjustment for everybody. It's it's what type based on what we're seeing. And then using all those tools, creating actual plan or an outline of a plan to move forward.
Okay.
So we've talked about, hey, we see some patients longer, like 8 months we talked about with her. But that was based on her scans. We created a customized plan for her.
Right.
And then your second appointment, we're going to sit down and review everything I've studied, give you copies of all of it, with including my notes all over everything.
Yeah.
Okay. And an outline of our plan. And I say an outline because we're going to come back and rescan and check as we
Right,
go.
it's gonna
so we're
change.
adapting to how the nervous system's changing. We have expectations. Hey, here's what we think was going to happen first. Here's what, and so we're adapting to how that changes. But this is
we
our
have a plan,
outline
yeah.
to move forward and base off of.
Okay.
And we like to have, I like to put this out there, we like to have both parents there.
Yeah.
Even if there is like a divorced situation or anything,
Sure.
we do, because we find that we need to have the parents on board, because again, we don't know what the nervous system and how it's going to heal, and to have those parents on board. And And we like to have that. And especially, I will praise Dr. Price. He's so good at talking to the dad and using dad language,
Yeah, it's so
and
good.
then talking
Yeah.
to the moms and using the mom language. But if we have both parents there, and then we find if they're both on board, we're going to have so much success with the child or
Right.
And it
the patient.
is often a struggle with one parent being on board and not another.
Mm-hmm.
But I have found 99% of the time, if you come in, you study, you look at it, most parents are like, okay, I want to at least give this a shot.
Yeah.
And I have a patient just this morning, her ex-husband is so against it, won't let her do anything. And we opened the doors like, well, he'll let you get an evaluation.
Yeah.
And she's like, yeah. I'm like, well, we won't do any care at all. Just get an evaluation.
Right.
Then there's information to understand if I can help
Right.
and go from there and have him come.
Mm-hmm.
And she's like, no, he will be obstinate and a jerk. I'm like, perfect.
Yeah.
He gets to see how simple
Perfect
the
for him, and
evaluation
we
is
got
and
him.
understanding.
Because what you guys, it's real. It's
Exactly.
not something you're not trying to sell something. You're not
No,
trying
no,
to. I
no.
mean, it's
And
it's
that's-
And we're
real.
so confident in what we do,
Right.
and we have so much certainty in what we do that I feel like it doesn't come across as like arrogant. Sometimes, like doctors, it comes across like we're here to help, and this is how we can help, and this is what we do, and here's the proof that we can kind of show you and kind of see.
Yeah.
And I feel like I'm a little more, but Dr. Price.
Oh,
is-
you really? Yeah.
But Dr. Price he's so good. I mean, they call him the child whisperer for a reason, and they call him all of the moms. I mean, you probably know how he is with Riley. Like he has a gift to be able to work with these
gentle,
kids.
yeah.
I mean, we even have parents come in, they're like, my child has never let a person get that close to
Right.
his ear, get that close to his neck, get that close to. For some reason, you're able to do this. But again, that's why we feel like it is his gift. And we work so good, or at least he does, with children with disabilities.
Yes.
And so I feel like we got off track. So day 1, and then day 2,
Yeah.
and then what happened?
And then from there, based on, hey, what our decision is, how are we going to move forward with care?
Okay.
Yeah.
And so, and sometimes.
And that looks different for
that-
everybody.
exactly.
Yeah.
Mhm.
Okay.
And there's also one of the things I have patients all the time. They're like, do I have to sign on to doing all that? I'm like, no.
Yeah.
It's, hey, here's our outline of our plan. We're
We
going to
want
move
you to,
forward.
but-
We would love if, hey, you're 100% committed, but it's okay to say, hey, I want to do this for a while and see. And that's where we educate and talk about, hey, these are the soft signs of healing that are seeing those changes.
Right.
And then as we come back, we can look and like, hey, look at how we've progressed and how it's going.
And it's funny, 99% of the time they want to keep going. And then they were like, I want to get my child in. Or, oh, I saw this great results with child. So, oh, I'm going to tell my grandma about this or my mom. And then it becomes this whole family affair.
Right.
And so that's kind of how that
It's fun.
snowball.
We have some days in the office, it's family reunion
It's like,
because
yeah.
we had
3 generations.
we had four, yeah, we
like,
had the other
"Hey,
day
get him
4
in."
generations in the office at the
office.
same time, all
That's
hanging out,
amazing.
and they hadn't seen each other for
Yeah.
Well, and it just makes so much sense. And again, when it's
Family
explained the way you
focused.
guys
Yeah.
explain it, it does help. And it's like I said, there's no downside to it. Like there is no bad side effects or nothing that's going to regress. I mean, so that's what's so amazing about it. But
Yeah, it's the best
so
investment for your
tell
health.
everybody your company and your website.
Yes.
We'll also link it.
Yeah.
So, but,
Yes.
yeah.
Our office is Summit Life Chiropractic. Our webpage is pretty easy, www.summitlifechiropractic.com.
Yeah.
We're very active on social media.
Yes.
So it's one
On
of the
Instagram.
Instagram is one of our
We
biggest
have
things.
one of the
and
best marketing people
Yeah.
that works for us.
So-
And if you go to our Instagram, we have so much education there. I mean, I can't tell you how many patients have come into us and just say, oh, I just binge watched you, just like I did with Dr. Tony.
Yeah.
And they're teaching themselves. And so when they come in, they say, hey, I saw this, tell me more about that. Or they're already kind of pre-educated.
That's
We haven't much got on to like YouTube, but you can also follow Dr. Price has a professional Facebook. So you can actually add him as a friend. He posts miracles every single week. He's posting, even things how he feels of like what's happening, with children's health when it comes to the Maha movement. You can kind of follow him. And then, we also are in the community a lot here. So you can come to our community events. We do lots of stuff with, Riley's residents, of probably what you're going to talk about next. But yeah, follow us on Instagram. Go to our website. You can even fill out a form on our website. So if you're just interested, you just fill out a form and then our CAs call you and have a full conversation with you.
And that's amazing.
Yeah.
And I know that you also do speeches. So you'll go in and talk to a group, which I
Yeah.
think is very helpful.
Yes.
So if there's employers on here or there's parent groups, mom groups, anything like that, that you want to have them go to, then I know that you'll be willing to do that too. So,
Yeah.
100%.
but I know you guys are super busy and I super appreciate you coming
Yeah.
out and
Yes.
doing
We
this.
love doing stuff like this. This is
fun.
fun.
Yeah. Well, you have so much passion, which I love the most, but also you have so much knowledge, and then your experience alone really just shows how important this is to you and what it means to help these people of all ages. And so I really appreciate your time. And
Yeah.
Yeah.
Well, we love you. And I think to praise you and just be like, you're a warrior mom, what you're doing with Riley's residents and like what you've done with Riley. I mean, you're
thank you.
the epitome of this warrior mom who has just never given up for her child.
Well, I appreciate
And
that.
we love you so much.
And you guys being a partner with Riley's Residents, and a lot of people that are listening don't know what we're doing, but we're building a development that will help intellectual and developmental disability children and adults. And one of the first partners we'll have on site will be Dr. Price and his team. So
Yeah.
that will be just having all the comprehensive care that our residents need right within walking distance. And then that'll be the first one
And
of
it's
its
been
kind.
awesome to see that dream come to fruition and just everything that you're doing. So yeah,
Yes.
we appreciate you and love you so much.
Likewise.